Welcome to the Relief Neuropathy Centers. This video provides information about relief therapy for peripheral neuropathy. We'll start by describing your nervous system. The central nervous system includes the brain and spinal cord. The peripheral nervous system includes the many nerves that emerge from the brain and spinal cord and branch out to the distant parts of the body. Peripheral nerves send messages about the body's condition to the brain by way of the spinal cord. The brain interprets the incoming messages and sends back instructions by way of these peripheral nerves. Peripheral nerves transmit signals along cable-like fiber called an axon. Some peripheral nerves are surrounded by a protective sheath called myelin. Large diameter nerves have a thick myelin sheath. Small diameter nerves have a thin myelin sheath or no myelin sheath at all. Different types of peripheral nerves have different functions. Sensory nerves transmit sensations of touch, temperature, pressure, and pain. The sensations are picked up by nerve endings and transmitted along the length of the nerve to the central nervous system. Sensory nerves also provide a sense of the body's position relative to its surroundings. This sense, called proprioception, supports balance and coordination. It allows healthy adults to walk without looking at their feet and to feel how hard they're pushing on the gas or brake pedals. Motor nerves transmit neural signals from the central nervous system to muscles. Motor signals permit the voluntary and reflexive muscle contractions that provide the strength and endurance for normal daily activities, such as walking or dancing. Peripheral neuropathy is caused by damage to the peripheral nerve anywhere along its length. The damage distorts neural signals and produces symptoms that tell us which types of nerves are damaged. Damage to large diameter sensory nerves may cause numbness, tingling, partial or complete loss of feeling, loss of balance, or loss of reflexes. Many patients have a sensation of dullness, as if they are wearing pads on their hands or feet. Damage to these nerves can make it difficult to feel the texture of the carpet or to walk a straight line down the hallway. Damage to small diameter sensory nerves may cause pain, burning sensations, cold sensations, sharp stabbing or electric shock sensations, or oversensitivity to touch. In some oversensitive patients, sleep is disrupted by even the light touch of the sheets on their toes. Damage to large diameter motor nerves can cause muscle weakness or spasms, poor coordination, and wasting away of muscle tissue. Without neural input to initiate movement, the muscles begin to shrink. As you can see, nerve damage not only causes peripheral neuropathy, it leads to decreased muscle strength and flexibility. The effect of nerve damage on muscle function causes its own set of symptoms. Lack of movement shrinks the normally elastic fibers of the skin and underlying tissue. This shrinking, called contracture, causes a feeling of stiffness or tightness, limits range of motion, and may cause pain. Patients may report skin numbness, the feeling of having a tight band around their toes or feet, or the feeling that their muscles have been shrink-wrapped. Peripheral neuropathy patients typically have some combination of symptoms, including pain, numbness, oversensitivity, tingling, burning, hot or cold sensations, muscle weakness, and loss of balance. Symptoms vary from patient to patient and may vary from day to day in the same patient. In general, symptoms start in the longest nerves in the lower extremities and gradually progress upward. Symptom severity increases over time, and symptoms affect even larger areas of the body. Relief Neuropathy Centers support their patients throughout the recovery process. Patients who actively participate in their own care achieve the best therapy outcomes. We'll ask you to take an active role by reporting your current symptoms at each treatment visit, reporting all therapies you have used or are currently using to treat peripheral neuropathy, and following instructions for stretching and exercises between treatment visits. We believe the symptoms of neuropathy should not define your life.